Oh, yeah, the hand sanitizer. Make sure you have plenty of that to go around. It's back to school time. And, of course, your kids, likely going to be bringing home maybe some disease.
You think?
With them when they come home.
So cooties out there?
We're going to talk to the expert today. The cootie expert? I don't know. Is that like an amicable way to put this? Dr. Wendy Anderson-Willis is a pediatrician at Nationwide Children's Hospital. And obviously, you know, kids come into contact with a lot of little germs and bugs and things like that when they head back to school.
They do. Lots of them.
Now, we want to start with a few of these different things. Now, some of them, let's start with the big ones, the ones that are vaccine preventable. So if we could call those up and go through these here, we're talking about the flu, chicken pox, meningitis, the more serious illnesses, right?
Absolutely. The shots are so important for our kids. So we want to make sure the toddlers get their shots, the kids get their shots right before school, and don't forget about the teen shots. Those are equally important, and that's when we give the meningitis shot. Again, so important for kids.
All right, so those, and then again, just make sure you're up to date, all the immunizations, things like that. Now the other one, simply washing your hands. These are the communicable diseases that you can prevent, like colds, pink eye, mono, strep throat. What's Fifth's disease?
It's like slap cheek disease, where your cheeks are really red, you have a little bit of a fever, and you feel awful. So we see it a lot in the school-age population. And the thing about that one is that it's really bad for pregnant women. So anyone who's around a child who has it has to make sure that we protect all pregnant women from that.
So we literally can use our Purell, which
Yes,
I
we can.
always keep just a travel one with me, as you can tell. Very small. No, but this will really take care of those germs?
It helps to prevent it. I mean, we're going to do everything that's possible to help keep our kids well. So washing our hands after bathroom visits, after, before eating, and then using hand sanitizer throughout the day is always a good way to just be protective.
Okay, good.
All right, that's good stuff. Now there are some that I guess the key is really catching them early. We want to put these up here. Things like head lice. You always see kids coming down with that.
Yeah.
Scabies, pinworm, jock itch, ringworm, athlete's foot. A lot of these sounds like kind of fungal things.
Very
but what's
communicable, aren't
what's,
they?
Yes.
What's pinworm?
Pinworms are little tiny worms that are around the
rectum.
Actually, yeah. And they
Wow,
itch.
I kind of jumped into that one, Sean. I didn't...
They really itch at night, and so they're spread by the fecal-oral spread. They're spread by hand to mouth. So dirty diapers, lots of problems like this in daycare. So we have to watch out for those too.
We played in the creek a lot when I was a kid.
Oh, there you go.
That's all I want to say.
Nice.
And it is very, very contagious.
It is. So you want to make sure that, if you think your child has it, you can use tape, and tape will pull out the worms in the middle of the night. And then you can show those to your doctor and say, look, my child has pinworms. We can give you one treatment, another treatment about a week later, and we're done with them.
Do you treat the whole family when that happens, like lice? Or not?
It's a little bit different. Okay. Mostly we see it in kids, but we'll cheat the children.
And what do you do with that piece of Scotch tape?
You throw it away. It's
Burn
over.
it in the backyard. Hey, and a lot of those, though, I mean, like jock itch, other things like that, the fungal things, just simply treated with an antifungal, right?
Yes, yes. And I think the problem is sometimes we know what it is and sometimes we don't. So always call your doctor. There's a nurse triage line. Ask questions, get the right information, and get them treated early.
And if I can flip back real quick to that vaccination list, are those annual vaccinations, or like meningitis, is that every year or is that every couple years?
There are a couple meningitis vaccines. So we have one called Prevnar, we give it to the babies. And then we have another one called Menactra, and we give it to kids at age 11, and then again at age 16 before they go off to college or whatever, to prevent meningitis that spreads through groups, schools, colleges really quickly. And so it's a great vaccine to have.
Well, that makes me think then too, I mean, obviously the kids are then coming home. What about the parents? So, as far as like getting up on like immunizations, things like that as well?
Absolutely. So we want to make sure all parents have their tetanus booster shots up to date. It has pertussis in it that protects the babies and the other young people in the family and the older people in the family from whooping cough. So lots of important vaccines for parents as well.
All
I
right.
can't remember the last time I looked at my vaccination list, whether or not I am up to date.
You might want to revisit
Every 10 years.
I've got those pinworms conquered.
I was going to say, at least now we know why there's so much Scotch tape at Sean's house. So all right, Dr. Wendy, thank you so much. Always great to see you. Great
pleasure.
information for the kids right there.